Morning, everyone. Today's topic is the homeless population in the United States. And I have here with me three speakers. First, I have George Sterry, Natalie Richards, and Hope Raymond. George is a mental health advocate, and Natalie runs an organization that takes care of homeless people. Hope is a healthcare worker. Okay, so as I said earlier, so the homeless situation problem is kind of getting serious here in the United States. So who is a homeless person? So homelessness defined as not having a fixed, regular, and adequate nighttime residence, and it includes moving frequently between different types of accommodations and staying in homeless shelters and places not meant for human habitation, example like vehicle or abandoned building. So the agenda for this webinar is polling answers, population descriptions, vulnerability, health issues, barriers to accessing healthcare, profile, actions, success, organizations. So first of all, Natalie, can you tell us the polling aspect?
Yeah, so we asked different people just to get an idea of what they currently thought about the homeless population in the United States. And we asked first, how many Americans are homeless? And then what are the biggest health risks for homeless individuals? The poll response was pretty split. Most people thinking somewhere from 100,000 to 500,000 plus individuals. And then the biggest health risk for homeless individuals, poll response was mental health and then followed by substance abuse and malnutrition. And the answers for how many Americans are actually homeless is over 500,000. And then the biggest health risk, this question was a little bit of a trick. It's all of them, but mental health is a little bit higher risk.
Okay, and can someone give us the population description? How is the population being described here?
Yeah. So in the United States, like I said, there's over 500,000 people experiencing homeless, which is about 0.18% of the population. 60% are able to find refuge in shelters or transitional housing throughout the United States. However, 40% spend their nights unsheltered, usually on the streets or in parks. Since 2020, with the beginning of the COVID pandemic, there's been a 3% increase in individuals experiencing homelessness and a 2% decrease in shelter availabilities. 52% of the homeless population lives in major cities and really urban areas, specifically Los Angeles and New York City. And then in Utah specifically, we have about 3,500 people experiencing homelessness, and about 20% are under the age of 18.
Okay, that's interesting. So how are these people vulnerable?
So this is definitely a high-risk population. They're 25 times more likely to report that they are dealing with physical health, mental health, and substance abuse conditions all at the same time than a sheltered person. They have twice as many visits to emergency rooms and ambulance rides, partly due because they are not able to access a primary care physician frequently, which means a lot of their problems compound. And then an interesting fact is that 80% of unsheltered women experience emotional, physical, psychological, or sexual trauma, which is significantly higher than the sheltered population. Specific health problems include COVID-19 vulnerability, violence, malnutrition, poor hygiene, mental health problems, and then alcohol and drug dependence.
Interesting. Thank you very much. Is there any recent news about this population?
Yeah. So like you said earlier, it's kind of on the rise in the United States. In this news on the left, it talks about there's 1 in 4 homeless shelter clients with serious mental health issues that were not able to access the mental health care that they needed, kind of leading again to that compounding trail of physical and mental health problems. And on the right, there's a recent news article about why it's hard for homeless people to get healthcare, again, going back to that primary care physician access.
Okay. And so, Hope, as you work with the health care industry, can you tell us the mental health issues about homeless people?
Yes, definitely. So mental health, poor mental health and homelessness kind of go hand in hand. A lot of times these people and these children will grow up in rough experiences. And it's about 1.5 million children a year are subject to these homeless conditions. And because of this, they go through trauma and PTSD. And these kind of symptoms get worse as they get older because of the lack of a stable environment that they live in. And without their basic needs like food and shelter, these symptoms often become worse. And then because they don't have a home, they feel isolated and alone, and they can't build these supportive relationships, which continue to allow their mental health to get worse and worse, and they just aren't able to get the help that they need in their day-to-day lives.
Thank you, Josh. Okay, so as we said earlier about mental health issues, I think it's a serious thing that these people are facing. So I would like to know more about what the healthcare, some of the barriers that these people are facing that is causing the uprising of mental health among them. So Hope, as you work with the healthcare industry, can you briefly give us the barriers?
Yeah, so highlighted here are just the 5 main barriers. And so the first one is chronic poverty. Obviously, poverty hinders parents' resources to provide their children's basic needs, which is also a leading cause of homelessness. And then there's also social isolation, which is just a lack of connection to people or to resources in their social circle. So people don't build very strong relationships with their families and such on the streets. And then also going along kind of with that, with the people that they are surrounded by, they have a weak social support. So that's by the people around them, but also with organizations in their community and government agencies. And there's also a lot of distrust with these types of public agencies amongst the homeless population. There's also a structural barrier because there's limited access to healthcare facilities. Like they could be far away from where somebody's having to stay, and obviously if somebody's homeless, they don't always have a car to drive to the facility.
Mhm.
And then there's just a social barrier because of implicit and explicit bias from healthcare workers, which is very unfortunate. But a lot of people feel hesitant to go visit the healthcare facilities because they don't feel very welcome.
Thank you. Can you tell us any profile as you work with people in the healthcare? You have patients coming in. So can you tell us any profile?
Yeah, so this is actually a guy I worked with in Australia, which is a little bit different from the United States, but he was a homeless man. I don't want to give out his name, so we'll call him Steve. He's a 35-year-old Indigenous male. He identifies the street as a place where he sleeps the most. He was only able to get up to 8th grade for his education, and then by the age of 22, which is very young, he was already heavily using alcohol and street drugs, and this led to intellectual and physical impairment. For example, he couldn't walk very well. Because of that, he actually got hit by 2 cars in 2013. This left him with a traumatic brain injury, which obviously has cognitive consequences, but also he had severe leg injuries. And these things are actually fixable, but he's stuck in a wheelchair because he can't stay in the hospital long enough to actually receive the full care that he needs and to let them heal all the way. That's because he's so addicted to drugs that he needs to get back on the streets to fulfill that need. And then also, it's just really hard to stay in the hospital when you can't afford it. And so, in our study that we conducted here, we asked, "What do you need to be safe and well?" And he simply answered, "A house." And so, I'll go into some actions that we need to take.
Okay.
So this is just a very terribly drawn picture by me, but it gives a good idea of the kind of collaborative work that we need to do. So this is Steve, the guy smiling, and the only reason why he's smiling is because he has a really good support system around him.
Mhm.
As we talked about earlier, it's a barrier for the homeless population because they don't have a very strong social support. So here we're demonstrating that he not only has a position, but he also has a social worker to address his homeless needs and to address like where he's living because, like he said, he just needs a house to be safe and well. And then insurance or whatever government policy helps him pay for the healthcare. That is also very important. And then also rehab for a lot of the homeless population is very helpful because obviously addiction is something that is long term. And
Mhm.
so we have to address that before we can implement any long term health.
I really like the fact that you brought all these because a lot of homeless people here in the United States can relate to this story and also to this holistic care. So thank you very much for bringing out this issue. So I think already discussed the action, right?
Yeah, and then I also, just to add a little bit, like we discussed earlier, a lot of homeless people feel discriminated against when they come to the doctor. So something that we can do as healthcare providers is to make them feel welcome, and then also implementing a care plan that is long term. So it's not just like we're seeing patients one time, right? Like we want them to come back and make sure we're monitoring other aspects of their health.
Okay, that's awesome. So, Josh, as a mental health advocate, do you have any success story that you'd like to share?
Yes. So in the 2010s, this group came together and they created an intervention where they put homeless people in 3 different groups. There was one group that was the long-term rent subsidies, another group in the short-term rent subsidies, and then the last group in the transitional housing and supervised programs with intensive psychosocial services. And then over the next couple of years, they checked in with these people and they saw how they were doing. And the one that was by far the most successful was the long-term rent subsidies because people in this group, they were able to reduce their homelessness long-term. They were able to gain better access to food and gain better healthcare. The other 2 groups, the short-term rent subsidies and the transitional housing, were not very effective in their ability to help the people because they would help for a little bit and then over time they would just get right back to where they were beforehand. So this intervention kind of showed that the best way to help homeless people across America is to provide these long-term rent subsidies so they are able to get back on their feet and back working again.
Thank you. Like, Natalie, as organization director, can you give us a brief story about what the organization is doing?
Yeah, so I can take this one. So 3 of the groups in Utah that are working to help with the homeless are the one is called Shelter the Homeless, the other one is called the Rescue Mission of Salt Lake, and the last one is called the Road Home. And essentially what all 3 of these organizations do is they try to give people a chance to get back on their feet, and they'll provide them with the short-term housing in hopes of getting them where they're able to get jobs again, and they're not having to worry about food every day. And by doing this, a lot of them are able to get the help that they need and get back onto their feet again.
Yeah, and it seems like it's shelter, that's the main issue. So I think most
Yes.
of them think that if they have shelter, they can also prevent the additional problems. Okay.
Mhm.
Okay, so we conducted a question review and we submitted our questionnaires to a lot of people. And some of the questions that we asked was how many Americans are homeless? The other is what is a prominent health risk for homeless individuals? What is not one of the 5 main barriers to accessing healthcare? What should healthcare professionals do to help encourage attending appointments? And the responses that we received are for the answer. So how many Americans are homeless? We found out that there are 500,000 plus homeless living in the United States. And what is a prominent health risk for homeless individuals? And we found out all of the above: mental health, malnutrition, unintentional injuries. And what is not one of the main barriers to accessing healthcare was lack of desire. And what should healthcare professionals do to help encourage attending appointments? Healthcare workers should be welcoming and avoid discrimination. So I have questions for, and thank you for all the introduction of some of the works that you're doing. But I have a few questions for you. So first of all, I will ask Josh. So Josh, why does poor mental health increase risks for physical health problems?
Yeah, so poor mental health can increase the risk of physical health problems because it can weaken the immune system, lead to unhealthy behaviors, neglect of self-care, and affect the brain-body connection. In order to reduce these risks, it's important to prioritize both mental and physical health, and not only seek help for the physical needs, but also the mental needs.
Thank you. And Ho, for your experience with working with people in the United States and also in Australia as well. So what do you think as a health worker, have you had any personal experience with a homeless population?
Yeah, so here in the actual United States, I actually work in the emergency room, and typically we see homeless people coming in either because they have mental health issues, which needs to be addressed, and then they need to be placed into a mental health facility, or they come in claiming that they have mental health issues or different physical issues because they simply want a bed to sleep in for the night. And so it's very clear that these people are, I mean, you can tell they're not in a healthy state, and they just want a roof over their head for the night, and they're having to resort to the hospital to do that. And so I think shelter really proves to be a serious root cause of their health disparity.
And Hope, how did you ensure their treatment was long lasting?
So for it to be long lasting, if they do have mental health issues, we typically send them to a facility where they can get better care specifically tailored for their mental health. If we find that they don't need to be hospitalized, we typically have them work with a social worker or a person called the care management people who will either organize like a shelter that they can stay at for the night, or they'll buy them like bus tickets to different places where they can stay, or taxi drivers, just stuff like that. So they organize a little bit outside of the hospital so that they have somewhere to go to and they're not just going to come back the next day looking for a place to stay.
Okay. And what is your advice when working with these people? Like other people also wants to know, especially our audience.
Yeah, so I think just as we mentioned before, a lot of times they feel discriminated against because we make judgments. We're quick to assume that they have problems or that they just want a place to stay. So I think just being welcoming and really trying to practice active listening when they're talking about their problems, but also asking about their home life, why they're homeless, if they have support from friends and family, stuff like that. So that way we can ensure that when they do leave, they're not just going home empty-handed.
Okay. And also one thing during the COVID, like, there were a whole lot of quarantine and stuff. So I was thinking about the homeless people, that how will these people deal with this pandemic while living on the streets? So Natalie, how did the COVID-19 affect the homeless population, and does it still have a large impact?
Yeah, so there's kind of two main ways that it affected the population. So first of all, COVID, it's a very communicable disease. It spreads really easily, and it's pretty easy to like if you have good hygiene, that helps a lot with preventing transmission of the disease. But it does cause if you don't have access to good hygiene and hygiene supplies, it's really hard for you to avoid getting COVID. And then on top of that, it's also if you have other physical or mental health problems at the same time, COVID affects that and make those things worse, and it gives you a worse outcome if you have COVID-19. So first of all, the population's already very vulnerable, and then second of all, you mentioned about like quarantines. There's a lot of restrictions on how close people could get to each other, which meant that especially during 2020, 2021, a lot of the shelters had to shut down or severely limit the capacity for the amount of people they could take in per night, which led to a lot of problems with finding shelter each night. And that 40% that I mentioned earlier that was unsheltered every night, that shot way up during the pandemic. And obviously the pandemic is still going on, but shelters are more able to open now, and everyone's just a little bit more equipped to deal with it and preventing transmission. So we've learned a lot, but it did have a large negative impact on the homeless population.
Okay, thank you. Okay, so to conclude, I've realized that like the homeless is a big issue, not only in the United States but also in across the world or across the globe. So it's a social issue that we all need to come together and address. And some of the key points that I gathered from your explanation is that we can do better. We can provide long-term permanent solutions to addressing this kind of issue, and we need to show more empathy and also care a lot for this population. However, does any of you have any final thoughts or recommendations to add?
I do see that there's a question in the chat. Somebody was asking if the homeless population has decreased at all, because based on our presentation, it seems like the problems are well known. And the homeless population, at least in Utah, first of all, it's kind of hard to calculate how many people exactly are homeless, but in general, they predict that the trend is actually increasing. So I think taking these actions and implementing better healthcare systems is just the first step in working on getting these people shelters.
Okay, actually, I wanted you to give me your final thought before I go to my question, but thank you for bringing that up. Okay, so, well, thank you all for your time.